Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Yes, doctor. My name is Elena Crisp and I am 35 years.
Okay, Mrs. How may I address you?
Please call me Elena.
Okay, Mrs. Elena. May I know what have brought you here today?
Doctor, I have having chest pain on my left side for last 2 days, and I thought that it will go away after taking paracetamol, but it is not going away, and I am really worried if it is a heart attack.
Okay, I will try to find out the cause. May I know that did it come along suddenly or gradually?
Suddenly, doctor.
Okay, and how long has it persisted? Is the whole time for the 2 days, or does it come and go?
For last 2 days, it is present always, that all the time. Just taking paracetamol made it somewhat better, but that is not up to the level.
Okay. Can you please tell me that how is it? Can you describe it for me, the pain?
Sharp pain.
Sharp pain. Okay. And does it spread to anywhere else, this pain?
No.
Okay. And can you please tell me that is there anything that makes it worse? Have you felt like that?
Yes, doctor. Taking a long inhalation or taking sometimes coughing make it somewhat worse. Not
okay. Okay. And anything that makes it better?
No, I haven't noticed anything.
Okay. Is there any specific timing on the of the day where it's worse or better?
No.
Okay. And if I get them 0 is to no pain at all and 10 is the highest pain, then how will you grade it?
I will tell it about 4 or 5.
Okay. May I ask you some other questions now? That do you have any raised temperature?
No.
Okay. Any shortness of breath?
Yes, doctor. A little.
Okay. And okay. And when do you feel that shortness of breath?
For last 2 days, but it was initially more shortness of breath. But after coming here, giving some oxygen, I am feeling better now.
Okay. And okay. And may I know that do you have any racing and pacing of your heart?
I think my heart is running more than normal.
Okay. And okay. And may I know that any coughs?
Yes, doctor. I also had cough several times for last 2 days.
Okay. Is it dry or did you produce any phlegm?
Yeah, little phlegm.
Okay. Have you ever coughed out blood? Have you noticed?
Yes, doctor. About 2 to 3 times.
Okay. And about 2 to 3. Okay. And, may I ask that is it the first episode that have occurred?
Yes, doctor. This time of this type of acidity is the first.
Yeah. Okay. And do you may I ask you that do you have any chest any chest tightness?
No.
Any noisy chest?
No.
Okay. And okay. And may I ask you some other questions? So do you have any headache?
No.
Did you have any loss of consciousness?
No.
Any weakness, any parts of your body?
No.
Any rash anywhere in your body?
Yes, doctor. You can see on my face there are some rash, and it is present for about 8 years. And I was diagnosed a case of the doctor said lupus something.
Okay. For how long was it? Have you been diagnosed for it?
8 years.
8 years. And have you been on any medication for this?
Yes, doctor.
Okay, which medication may I know? Can you remember?
That is called mycophenolate mofetil and hydroxychloroquine.
Okay, and do you take that regularly actually?
Yes, doctor.
Okay, and may I ask you some personal questions at this moment, if you allow?
Okay, doctor.
Do you take any pill for your contraception for preventing childbirth?
No, doctor. I am taking to take baby.
Okay, that's all right. May I know that how is your period? It's actually again a personal question.
That's normal.
Okay, and may I know that do you have any issues, any child issues, any children?
Yes, doctor. That happens twice. I lost my babies.
Okay, and may I know that at what time of your pregnancy did you lose? I'm very sorry to hear about it, but can you please tell me?
Yes, doctor. That one was about 12 weeks and another was 10 weeks.
Okay, 10 weeks. And may I ask you that, did you had any recent long travel recently?
No.
Okay, any history of operation recently?
No.
Did you had to be bedridden for any cause recently?
No.
Okay, and may I ask you another personal question now that do you smoke?
No.
Okay. Do you drink alcohol?
No.
Okay. I would like at this moment. I would like to examine the patient.
Okay.
Okay. I would like to have a close look at the patient. There is if there is any malar rash or discord rash.
Yes, you can see that there is.
Okay. And I would like to see the oral cavity if there is any oral also present.
No.
Okay. And then I would like to examine the pulse.
It's 110.
Okay. And then I would like to have a look at his. At first, I would like to now auscultate the heart, all heart fields. S1, S2, and any murmur present.
No.
Okay.
2 minutes
And
remaining.
okay. And I will now at this moment I would like to look at the pedal edema. Any edema present?
No.
Okay. I would just like to have a close look at his legs, whether there is any DVT present or not.
No.
Okay. And I would like to have his record of blood pressure and pulse oximetry.
Yes, pulse oximetry is oxygen saturation is 93%. He is on oxygen.
Okay. Okay. And may I at this moment ask you what your concern is?
Why I am having this, doctor? Is
Okay.
it a heart attack?
Yeah. Okay. At this moment, may I know that? Well, at this moment, as long as I have examined you examined you and taken history, I think that you might be suffering from a condition named pulmonary embolism. Have you ever heard of it?
No, doctor.
Okay. Actually, it's a condition when there can be some clots in your lung vessels, and this can occur due to many reasons. And one possibility is that since you had been suffering from a condition named SLE, and you also had some history of child loss, there can be a condition named SLE and antiphospholipid syndrome. Don't bother about the term. It's actually a condition in which your body's own cells can act as foreign, and they can attack its own cells. And sometimes this condition is associated with some clotting in your blood vessels. Okay. And this clotting can go to your lung as well. However, we have to be sure about it by doing some examinations, some tests. But in the meantime, so that you do not get worse, we will start giving you a blood thinning agent. Okay. Are you getting me?
Yes, doctor. So do I need admission or I can go home?
Okay. I think we will admit you so that you don't get worse. And at the meantime, we will at the same time we will treat you and treat you so that you don't get worse. And at the same time, we will do the scanning and some other blood tests to find out the real cause. Are you getting me?
Yes, doctor.
Okay. At this moment, can I just ask that? Do you have any more?
Time up.
Okay.
So what is your diagnosis?
I think the diagnosis is pulmonary embolism, most probably due to secondary APS, antiphospholipid syndrome, due to SLE.
Okay, what are the positive findings you have found?
The positive findings that I found is that history of hemoptysis, then sharp chest pain, worse with deep breathing, then tachycardia, and then for SLE, I have found a malar rash or discord rash, I think. Okay. I think these are the most positive findings. And also in the history part are a previous history of child loss.
And how do you investigate her?
Okay. For this, I will have to do some baseline investigations like CBC counted with ESR and CRP, and also I will have to do some blood tests like D-dimer test and also CTPA scanning as well. And at the same time, I will have to do some chest X-ray, ECG, echocardiography, urine RME, and serum creatinine.
What is the specific test for diagnosing pulmonary embolism?
The specific test, first of all, to rule out the high sensitivity is actually so the high negative value, predictive value is D-dimer, and the most specific is the CTPA.
Okay. Any other test except CTPA?
Yes, there can be perfusion scanning, VQ scanning.
And perfusion scanning. Okay, that is fine.
Yeah.
So how will you manage that?
Actually, we will. I think I will manage him at an emergency basis, so that I will admit her, and I will give him some blood thinning agents like subcutaneous low molecular weight heparin, and I will involve the blood doctor, the hematologist, the cardiologist, and the medicine specialist in this case for further evaluation. And also, I will give her supportive treatment by giving oxygen and some pain medication.
Okay, so you are saying that you will admit her, you will give her symptomatic medication, symptomatic supports, and you will give her low molecular weight heparin, and then you will involve multidisciplinary team.
I think so.
Okay, that's fine. Thank you.
Okay.
So in this case, you were totally fine. There was something that I think you could have addressed earlier because this
Yeah.
patient has chest pain. So you could have asked, okay, can you talk now about your chest pain, or do you need any medication before we start? She may have severe chest pain. You do not.
Yeah, that was a grave mistake then.
And her saturation was low. It was given.
Yeah, that I saw that. So
Yes.
what could have I done?
Okay, you could say that. Okay, I on the machine reading, I can see that your oxygen level is low in blood. Do you feel any shortness of breath, or can we just start, or you can ask the examiner that I am seeing saturation is low. So can I start start giving her the oxygen support by nasal cannula or anything else? Then I can start talking, or should I proceed now?
Do you feel breathlessness, or do you? So if so, uh, I don't think she will tell, but I will have to ask her. Okay. On the machine reading, I think that I see that your oxygen level is low.
Okay, you can ask the examiner that I can see that her oxygen level is low at this moment. Should I go for the oxygenation? Then I will start talking, or I will start talking right now.
Okay.
Okay, and at that time, patient also said in the meantime that she is having shortness of breath. So you could have asked,
Yeah.
do you need to?
Yeah. I get.
Can I start the oxygen support?
Mm.
It's low on the
Yes.
machine reading. You even didn't express anything.
Yes. I get it. That was very great.
Otherwise, you have managed everything very well. And one thing that I cannot remember if you have asked about is her occupation.
No, I didn't ask about occupation.
Some occupation that is long standing or long prolonged sitting position, maintaining maintaining protocol sitting position. That also is it.
Yeah. Yes, that was very important also.
And when talking about any diagnosis, please always try to say it in the full form, not a PS, not a silly.
Yeah.
Your investigation that was fine. Also, you tell CTPA.
Yeah.
Should at least try, and also try to find out, try to tell about the what be your expected results. Suppose if I ask you that what do you expect on the ECG, what do you expect on the echocardiogram? Okay.
Yeah.
So you could have answered that I am expecting this, I am expecting that. At that time, if you have answered it, then it would run. Otherwise, I am doing this test. Okay, I know that you are going to do this test, but what would be the interpretation? Okay. Otherwise, this was very fine.
Okay.
And also, you should have told her at the earlier point that okay, this is not heart attack, but this is a serious condition if it is not treated. And for this, we advise you to be to remain admitted, and we will start the medication in the meantime. And also, as far as I remember that current guidelines says that directly acting oral anticoagulants at the first line now.
Oh, oral anticoagulants. Yeah. That's important. That was important. Okay. And
Are you ready? Should we go for the
just
second
1 minute. I'm just writing those down.
And also, you haven't asked about any family histories related or not,
Yeah.
and also any other medication is she taking, except those.
Yeah.
Okay.
Yeah.
Also, you should have asked about her. Uh, what was I telling? I forgot. Oh, any past history of clotting or any clotting disorder.
Mm-hmm.
Okay, you should have asked that.
Mm.
Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
My name is Ryan Ronald, and I am 68 years.
Okay. Today how may I address you?
Please call me Ryan.
Okay. Well. Mm, okay. And today we are going to discuss about your health issues. Is that all right?
Yes, doctor.
Okay. And may I know that what has brought you here today?
Doctor, for the last 3 months, I am losing and I am suffering from loose stool, and that is very worrying for me. And I am also fed up, and I am now becoming mass more weaker day by day. So
Okay.
I cannot even. This is the weakness is so severe that it has become I cannot even do my personal activities now.
Yes, I'm very sorry to hear. I will try to find out the cause. May I know that did it come along suddenly or gradually?
Gradually, doctor. Initially, there was about 2 to 3 times a day, and it is increasing now.
Okay. And uh, well, can you please tell me that what is the color of the bowel motion of a bowel movement?
I think it is normal, but more liquid.
More,
Liquid,
more liquid. Okay. Have you ever faced any mucus?
not so much.
Okay. Or any bleeding anytime?
No,
Okay. And okay. And have you noticed anything that makes it worse or better?
no, doctor.
Okay. And okay. And may I ask you that do you have any tummy pain?
A little.
Okay. Okay. And may I just ask about again about your bowel motion? That have you noticed that there is any relation with your food of your bowel motion?
No, doctor. But I am somewhat becoming reluctant to food. I don't have much appetite for food.
Okay. And okay. And may I ask you now that do you have you ever had to get up at night to open up your bowel?
Yes, doctor.
How many
Sometimes two
times?
to 3 times a day.
Okay. Okay. And may I ask you that did you notice any loss of your weight?
Yes, doctor. I've lost about 7 kg over the last 3 months.
Okay. Okay. And I get it. And may I ask you some other questions now? That do you have any tummy pain?
A little. I told you.
Okay. Where do you can you please tell me?
The center of my tummy.
Okay. And any nausea?
Yes, doctor.
Okay. For how long?
For the last 3 months.
Okay. Any vomiting?
Vomited only for a few times, not so much.
Okay. Well, have you ever noticed any blood in your vomit?
No,
Okay. And how is the content? What is the content of the vomit? Have you ever noticed?
Sometimes the food I take, but the vomiting is not so severe, doctor. For me.
Okay, I can get it. And okay. And may I ask you some other questions now? That have you ever been noticed any yellowish discoloration of your body?
No,
Okay. And may I ask you some other questions now? That do you have any weather preference?
no,
Okay. Any tightness in your skin or any tightness while opening your mouth?
no.
Okay. And do you have any problem with your digestion? Have you noticed?
I told you that, doctor. I do not have much appetite.
Okay. Okay. And may I ask you that have you ever noticed any funny color changes in your hand?
No, doctor, but I am having this type of abnormal color change on my some parts of my body. You can see that there are some type of abnormal color and sometimes white colors on my body, and also sometimes I got that I am getting somewhat red flushed.
Okay. Red flush. Okay. And may I know that do you have any chest pain?
Sometimes I have
Okay. Where is it? The center part or outer parts?
central part, doctor.
Okay. And may I ask you now that do you have any shortness of breath?
Sometimes.
Okay. Any nausea chest or chest tightness?
Yes, doctor. That is also bad
For
thing.
how long have you been facing this?
I think for the last 3 or 4 months.
Okay, I get it. And may I ask you some other questions now? Do you have any more history, any more disease history?
No, doctor.
Okay, any medication that you take?
No.
Okay, and any may I ask you some personal questions now?
Okay, doctor.
Do you smoke?
I previously smoked, but I am not smoking for last 3 years.
That's very appreciable. Do you drink alcohol?
Yes, doctor.
Okay, have you ever noticed that while drinking alcohol, your symptoms increase or decrease, something like that?
Sometimes get worse.
Okay, okay. And may I ask you that do you have anyone in your family having similar type of symptoms?
No.
Okay. At this point, I would like to examine the patient.
Okay. 2 minutes to wait.
I will have to have a look at the patient. It's reddish, I think, reddish face.
Yes, there is some
Okay.
discoloration.
Okay, and I would like to have the pulse and BP recording. Pulse 68, BP 110 by 60, I guess.
Yes.
Okay, and I will just have to look at the back. Okay, not at the back. At the beginning, I just have to look at the tummy to find out any pain.
No.
Okay, and then I would like to go for the legs for to see any edema.
No.
I will tell the patient please to sit down, please.
Okay.
From the back, I would just to want to auscultate the lung.
Okay. Lung is some you can get some bronchi.
Okay, that's all right. Well, may I know what is the concern is?
Why I am having this, doctor? Is it a cancer?
Yes, well, at this moment, as long as I have examined you and taken history, I think that you might be suffering from a condition named carcinoid syndrome. Please don't get bothered at this moment. It can be some growth. Okay, in there can be it can be actually caused in this condition. Your symptoms actually go along with this condition. Please don't bother about the term. In this condition, sometimes there can be some bowel disturbances and also some problem with your skin and breathing. However, we have to confirm it by doing some blood tests and some other tests. We will involve the hormone specialist. What we tell endocrinologist, the hormone specialist as well, to find out the cause. Okay, and we will get to you again as soon as we are sure about your diagnosis. Will that be all right?
Can it be cured?
At this moment, we cannot be totally sure about it since we don't know the diagnosis totally. But if it is what we think, there is very good treatment for it, and I think there is very good treatment for it. And usually that disease runs a very slow course. So usually treatment.
Time off.
Okay.
So what is your diagnosis?
I think my diagnosis will be carcinoid syndrome.
Any other differential do you have?
I think regarding his age, there can also be some cecal carcinoma, and I think regarding weight loss, there can also be ileocecal TB or colonic lymphoma. Or I think
Okay. So you've said carcinoid syndrome. What are the points in favor of your diagnosis?
the patients look flushed when I looked at him, and also there have been some breathing difficulties for the last 3 or 4 months associated with bronchi, and there is also bowel disturbances.
Okay, so how will you investigate him?
Well, at first, I would like to do some basic blood tests like complete blood count with ESR and CRP to rule out any infection present or not, or inflammation present or not. Then I would like to do a chest X-ray view to find out whether lung fields are clear or whether there is any difficulties in it and any problems in it. And then I would like to go for his plain X-ray abdomen, immediate posterior view to have a look at the abdomen. And then I would like to go for a specific test like 24-hour urinary 5-hydroxyindolic acid, acetic acid, to find out whether it's increased or not. And if it's increased, then it goes in favor of carcinoid syndrome.
Do you think that this patient also needs endoscopy?
Yes, sorry. I also this patient must go undergoing endoscopy.
And
as well.
any stool routine examination?
Yes, this patient needs endoscopy, stool routine examination, and if the gastroenterologist thinks he might also have to do colonoscopy as well.
I think endoscopy covers upper the endoscopy and lower the endoscopy. Okay.
Oh,
So,
okay.
do you also think that this patient may need CT scan of the abdomen, CT scan of the chest?
Yes, might. Yes, yes.
Okay. So how will you manage him?
I think at first I have to patient education counsel the patient, and then I will have to form a multidisciplinary team, including medicine consultant and also endocrinologist, and then I would go for the specific treatment, which would be, I think, the somatostatin analogs, octreotide. I think this is the most specific treatment for this patient, I think.
And what do you think? This patient asked you that is it a cancer or not?
Well, actually, I think that it's a neoplasm, okay, but I don't think that should I tell it a cancer, because I don't think it's a benign growth. I think.
Okay, so is he going to be cured or not?
Well, at that part, I was not totally sure. I think I had to keep it under control.
Actually, carcinoid syndrome, though it is named carcinoid syndrome, its symptoms appears when it metastasizes.
Yes. So what should have I told her? Then.
Suppose that is secretion. Sometimes serotonin like factors, they all are get cleared up by the liver, and when it metastasizes, then liver cannot clear them up. Okay. And so the
when
symptoms
he asked.
Okay, actually,
When he
the symptoms has the symptoms suggestive of that it has went too far, and we will I will involve the doctors for this, and they will be able to give you the best answer for this. You do not know the answer, and you will find the answer after.
I should, if I tell that the symptoms have gone too far, then we won't be panic.
Okay, he has shortness of breath. He has wheeze. He has chest pain. He is splashing.
Yeah.
And do you think it is at this time it is confined to the gut?
Yeah. Okay. So I can tell him that. Okay.
Okay.
And what about the cure? I don't think what should have I told?
Okay, first you will have to find out cause and its extension. After that, you will be able to give the best answer. Till now, it is not sure, but I'm afraid to tell you that it is most likely went to other parts of the body. and we will involve the doctor. That is, you also need to.
When he asks that is it a cancer, what should have my answer been?
Is a type of cancer.
Okay. Okay.
Okay, and another thing that you haven't included oncologist
Yes.
in your management plan. Okay, and I think you went very well. Okay, just one thing that this patient also needs nutritional supplementation. Carcinoid tumors, they take up mass niacin and other vitamins, so they need support for that.
Okay.
Do you want to add anything? I can remember this part.
Okay, I can remember as well. Okay, so I think that's for this case.
Okay, this also can cough with chronic cough. Okay, this can cough with shortness of breath. This can cough with the honey color change.
So Carcinoid syndrome can also, that's a very important point that you told, can also come with.
Also in the examination, you have missed clubbing, you have missed to examine the heart. There might be the tricuspid regurgitation.
Yes. That was a grave mistake.
I thought that when you have asked about back, then I thought that at least you will go for the chest.
Yes.
Okay.
Okay.
Thank you.
Okay, Sam, thank you. This case is done.